With its picturesque lakes, historic districts, and centers of art and culture, the city of Lakeland has become one of the most sought-after places to live in the state of Florida. It is also home to Lakeland Regional Medical Center, a not-for-profit hospital that has served the people of this region with the most effective, safe, and compassionate care possible for nearly 100 years.
We are the only trauma center here in Polk County, and so although we've not been able to provide the rehab that these patients have needed, we've been able to provide the acute services.
We see a lot of severely injured trauma patients. We see about 1,600 patients annually. Just over half of those are considered our most severely injured patients.
We never turn down anyone here at LRMC. Everyone gets the same level of care, which is excellent care. It doesn't matter what your ability is to pay. It doesn't matter what hospital you've been to in the past. We do the best that we can for every patient.
It became clear to the leadership team that Lakeland Regional desperately needs an acute rehabilitation institute. Currently, patients travel up to 2 hours, sometimes more, for inpatient rehab. Lakeland Regional needs this institute in order to provide seamless care for people recovering from stroke or trauma. The team is currently in high gear, designing and constructing a 32-bed rehabilitation institute with a goal of completion by late 2015.
When you have a building of this size, with this many patients, with this big of a community, with as much trauma as we do, that this is that one missing piece that we need to have to get the best outcomes for our patients.
I was airlifted to Lakeland Regional, immediately induced into a coma.
My life was just perfect. I was just going about my day. My life changed in a blinking of an eye. Now I can't move my neck.
I ran off the road, ran my floor into a tree, through a fence, and I wound up having a traumatic brain injury.
I was in the coma for a whole month, over a month.
I have scars everywhere. I have metal all in my body at 22 and almost died.
So I remember waking up in the hospital, and then I remember trying to move with my fingers, my feet, and my mom was holding my hand. I couldn't really feel her hold my hand, but I knew she was there. And I thought I was really, really hurt, like paralyzed, or I didn't know what was going on, really.
I woke up a month later seeing my body completely destroyed.
Santiago. Santiago, open your eyes. Good job, baby. You're okay. You're okay, baby. You want to go back to sleep?
When he first opened his eyes, it was just like I can breathe again. Like I can breathe, I can sit, because that's all I wanted to see. I wanted to see something from him. I wanted to see a reaction. And I wanted just to see hope that everything was going to be okay.
We do exceptional things from the time they are picked up in the field by EMS, brought through the doors of our ER into our trauma center. Throughout their entire hospital stay, they have this amazing, dedicated team of healthcare professionals. They build this relationship. But at the end of that, we have to set them loose.
She ended up having a fracture of the C1 and C2, which in essence meant that she was anatomically decapitated. Most of my patients end up going to other facilities for inpatient rehab at outside institutions.
I just mainly remember the ride there, and it was so long. It was like 3.5, 4 hours, and just coming out of neck surgery, the bumps in the road. I mean, I cried the entire way there.
We didn't get there till that evening. It was just a most terrible thing that no one should go through. There should be something here locally for someone like her or in trauma to go straight to. Because when we got there, she was just out of her mind in pain. So I stayed the first night, which was, you might as well sleep on the floor. So I realized then that if I don't have rest or what I need, I can't take care of her.
Watching my parents go with me through my accident was one of the most heartbreaking things that I think I've ever had to go through. It was hard. I don't know how they did it. When he was doing the physical therapy in Lakeland, I felt like he was comfortable with the people, the therapists there. But when he was transferred to another rehab center, it was really tough because that's when it really hit him. The first day he was crying. He wanted to go back to the hospital. He wanted to go back to the people he knew.
I went into a really bad depression. The main reason why is because I was already used to physical therapists that took care of me and they knew everything that I was going through. You know, seeing new people that had no idea what I went through.
He would just cry constantly. He didn't want to eat. And the toughest part was hearing him say that he didn't want to live anymore.
How are you? I'm doing great. It's good to see you. You look wonderful.
Dr. Gluck saved my life, hands down. If it wasn't for him, I don't know if I would be here or not.
Sierra, Santiago, and Bo are all heroes of their own journeys. Each overcame significant obstacles thanks to the expert staff at Lakeland Regional and the support of their family and friends. Bo worked for 3 years at the hospital, caring for patients and encouraging them as he transported them throughout the hospital. He has now returned to his career in real estate.
You did good.
Lakeland's goal is to create a nationally recognized acute rehabilitation institute where patients will receive state-of-the-art, individualized care right on the Lakeland campus.
Rehabilitation is the most intense form of service that an individual can get after catastrophic injury or stroke or spinal cord injury. The disciplines involved are physical therapy, which works on mobility training, getting back to walking, occupational therapy, which works on activities of daily living, such as cooking, cleaning, dressing, toilet transfers, and speech and language pathology services, which helps individuals with swallowing disorders, reading, writing, cognitive issues that are sometimes impaired after a stroke.
The $12 million design is truly, for me, inspirational. It has a lot of patient-centered focus to the rooms.
32 private rooms, approximately 33,000 square feet of space, a unique and innovative state-of-the-art ceiling lift track system that will help patients with mobility and gait training.
We're designing this unit with the family in mind, making sure there's ample space for the family to join the patient in their patient room, as well as in the common social areas so they can join them for a meal and just the day-to-day activities that we anticipate the patients will be able to start doing again after their time of discharge.
We have had nationally known rehabilitation experts give guidance, not just on the design of the unit, but the design of the program.
So Elaine Thompson called me and started explaining first that they were going to build a rehab unit, and that's not novel, so okay. And then she started talking about having a different vision for rehabilitation.
For almost 20 years, Dr. Behrman has been a leading clinical researcher in the area of neurorecovery for children and adults with nervous system disorders. Currently, she is working exclusively with children with spinal cord injury. She is also co-director of the Christopher and Dana Reeve Foundation Neurorecovery Network.
She said, I know you're a scientist, I know you know what's cutting edge, I want to know what that is. I don't want just to provide ordinary care, I want it to be exceptional care. She's willing to alter the course of rehabilitation and perhaps even fly in the face of traditional rehabilitation to do that, but wants to base it on science.
Recent scientific discoveries reveal that not only is the brain smart, but the spinal cord is smart too. It can be rewired to learn after injury or disease. Intensive programs like locomotor training can lead to remarkable new abilities. With repeated sensory input through assisted stepping, the spinal cord can learn to contribute to the control of walking, even after the connection to the brain has been severely damaged.
We've done tremendous studies that look at the time a person spends doing actual practice and repetition in therapy, and it's minimal. There's a ton of studies that demonstrate that practice and repetition is necessary to change the nervous system, and so we have to beef up the intensity.
We really want to take the individual from injury to recovery, and we're going to use a blended treatment approach where we try to provide as much as 6, 8, or 10 hours of therapeutic activities a day outside of the required 3.
I think by really looking at how we can make every hour that they spend on this unit part of their therapy care will really change their outcomes.
All right, let your arms go back a little further.
So much of our community is elderly, being that we sit in the state of Florida. And I think we'll have this wonderful spectrum of care that we can give her, both for very young patients, but there also will be a keen focus on making sure that we really can optimize the last decades of someone's life if they've also had a traumatic event.
The doctor, they came in and told me he had had a hemorrhagic stroke and that he would not live through this. Get the family here now because he's going to pass. And I said to myself, he's not going anywhere. He's going to stay with me. And I sat beside him and just talked into his ear. Just talked and talked. And that's what I did for months.
I thank the good Lord. Still here.
I'm not going to let you go anywhere.
I know.
Bill's journey has been remarkable, but early on, Lakeland's lack of an acute rehab center took its toll on them as well.
I would get up at 6 in the morning, take care of the dog, get ready, drop the dog off, and I'd drive an hour to the hospital. I'd stay all day. I'd leave about 5 o'clock, drive another hour home, pick up my puppy dog, go home, went to bed, and got up the next day, every day, 7 days a week.
This is your community. These are your friends. These are your neighbors. These are people that you see every day. This is what you would want done for you. This is what you would want done for your family member if they were placed in this devastating situation where their life has been turned upside down.
Well, I'm his right-hand man.
Yeah, tell us, yeah.
Like I said, he's gotten his memory back all the way. And now he'll fix anything in the house. I'll hold with my hand and help him or give him his tools and everything like that.
And the left hand is what this can't do, she can do.
Helping these patients get back to a higher level of functioning is good for the community as well. We want them to be productive members of society. We don't want to leave them in a place where they're still having ongoing needs that haven't been met, because that's probably far more costly than preventing those things.
All along I've told them, you're going to walk. You may be with a cane, but you're going to walk again, and I'm so proud of you. I keep telling him I'm so proud and I love you so much for what you're doing. But he'll make it. I know he'll make it.
I know I will.
And we'll go dancing again, right? Right?
That's right.
That's right.
This is that one missing piece that we need to have to get the best outcomes for our patients.
We've been planning for this for a long period of time. There's been a lot of thought into it. There's certainly been the need. We're really excited.
So having this rehab center is going to give us that final closure. It's going to keep those patients in our arms until we can release them recovered back into the community.
Because whoever gives money to help this facility, they just don't know how much is given to these families, so they don't have to travel and be put up in a hotel for weeks and months to be able to stay here. And that's such a big gift. What a blessing that somebody's going to be able to. I wish I had the money that I could give, because I would love to be able to bless somebody with the fact they help get their family started, get their life going again. It's priceless.